What challenges exist in diagnosing articulation disorders? Imagine trying to solve a puzzle where some pieces look alike and others change shape depending on where you look. Diagnosing articulation disorders can feel just like that. It's not always straightforward. One big challenge is telling apart articulation issues from phonological disorders. Articulation problems happen when a child has trouble physically producing specific sounds. Phonological issues, on the other hand, involve patterns of sound errors. Sometimes, children make errors for both reasons, making it hard to know what's really going on. Another challenge is that articulation problems often happen alongside other issues. For example, a child might have a speech sound problem and also be delayed in language skills. This overlap can make it tricky to figure out if the problem is purely articulation or part of a bigger language delay. To get it right, speech therapists need to do a full assessment, looking at all aspects of communication. The causes of articulation disorders can be very different from one child to another. Some children have physical issues like a cleft palate or dental problems. Others might have neurological conditions that affect how they plan and coordinate speech movements. Hearing loss can also play a role. Sometimes, there's no clear physical reason at all, which makes diagnosis even more complex. It requires detailed medical history and examinations of the mouth and ears. Age and developmental stage are also important. Some speech errors are normal at certain ages. For example, young children might substitute sounds or leave out certain sounds as part of learning. Knowing what's typical for a child's age helps avoid misdiagnosis. If a child is older and still making typical errors, that might be a sign of a real issue. Speech performance can vary a lot from one moment to another. Some children produce sounds correctly in one situation but not in another. Others might make inconsistent errors. This variability means therapists need to observe the child multiple times and use standardized tests to get an accurate picture. Cultural and linguistic differences add another layer of difficulty. Dialects and language backgrounds influence what sounds are normal or expected. What's seen as an error in one dialect might be normal in another. Therapists need to understand each child's language context to avoid mistakes. To diagnose articulation disorders properly, speech pathologists use a mix of tools. They might do speech sound tests, analyze speech samples, check oral motor skills, and test hearing. They also look for signs of motor planning issues, like childhood apraxia of speech, which involves inconsistent errors and difficulty with speech rhythm. Overall, diagnosing articulation disorders is a careful process. It involves understanding the child's physical, neurological, and language development. This thorough approach helps ensure that children get the right support and treatment tailored to their specific needs.